Like, I knew that there was something medically and physically wrong with me, because you shouldn't be this weak when you're pregnant. You shouldn't have all these problems. A female body is created to have babies and to give birth naturally, you know, without any of these super complications that I had. After, I think it was 2018, my kids were finally sleeping through the night. I had time to read, I had time to research. I started looking for why. Why did this happen to me? Why was I weak? Why did I have hyperemesis? Why did I have ketosis and had to go to the hospital every other day to get IV drips? Why did I have nausea throughout my pregnancy of 9 months with my daughter when I was supposedly healthy and lean and fit? And I started researching, and I went deep into the root cause of what makes a woman healthy to bear children, to physically be strong enough to have children and have a natural delivery, lower the rates of morning sickness, not have any complications, and have a natural delivery, and be able to breastfeed after having delivery. And I realized that nutrition is such an important reason. Nutrition preconception, up to 2 years, plays an important role in any pregnancy. And so I started researching and started implementing that in my online consultation. So to date, since 2018, I have helped around 4,500 women in the GCC, pregnant women, prenatal, postnatal, menopausal, young women that have PCOS or any hormonal imbalance, through my online consultations, incorporating what it means to live a healthy lifestyle. So it's not only food, it's how you sleep, it's the quality of your sleep, it's how you manage your stress, it's what kind of workouts you have, it's your mental health more than anything. Mental health plays a huge role, and I have a database of professionals that I refer to. So if I see somebody that has needs any mental health or support, that's not in my scope of work, so I refer them to a therapist. If I see somebody that needs further functional diagnostic testing to check their gut, I refer them to somebody else. But I manage the nutrition part of it. And I think this is such an important part of nutrition nowadays, is to treat the root cause. So yes, we can fix your nutrition, we can fix your food, but if that's not the root cause of what you're feeling and the reason why you're feeling sick and you don't feel well, then there's no use of just fixing your food on its own. So that was one part of my journey with natural health. The second part was in 2020, where coincidentally I had signed up for a 3-day course in the UK in one of CNN's courses, and then COVID hit. It was a homeopathy 3-day course, and I wasn't able to attend the course because all the flights were canceled and we were, as you know, stuck here in Kuwait. And years later, CNN contacted me to be their ambassador, so it kind of felt like full circle, and hopefully I'll be joining one of their programs soon enough. So in 2020, the reason why I was looking for different answers is because I suffer from migraines. Since university, I remember studying in my master's thesis. I was writing my master's thesis and I got a very, very bad migraine. I didn't know what it was. I wasn't aware what a migraine was. So I went to the ER and they did a CT scan. They're like, you're fine, it's just a migraine. And I was like, so why is this happening? They're like, okay, just take some meds, it'll be fine. And the migraine kept reoccurring. And I didn't know why I had these migraines. So in 2020, I had enough. It's been around 10-15 years since I've had migraines twice, 3 times a week. It's not normal. And if anyone here suffers from migraines, you know how bad it is. You can't do anything. When I get migraines, I can't even leave my room. I lay down in a dark room. I can't tend to my kids. I can't put them to bed. I can't be with them in bedtime and read to them a bedtime story. And it was affecting my life. So I started to research, and I started talking to functional doctors in the States, and homeopathic and naturopathic doctors in the UK. The reason why it was all abroad is because I was not aware of any professional in Kuwait that could help me. And I started doing functional tests, and I started doing GI map test, the O test, the organic acid test, mycotoxin. I was checking the heavy metals in my body, and I realized that I had a hormonal imbalance. So my doctor in LA diagnosed me with a progesterone deficiency. And once I started using bioidentical progesterone, the migraines vanished. So it was a simple diagnostic symptom that I was having, which was the migraine, but they were telling me that I had something wrong in my body, and the reason was the progesterone deficiency. And I know so many women that suffer from migraines, and they go to doctors, and they just take medication, or they take, they use Botox. It's like a Band-Aid on the actual root cause of why they're getting migraines. And I started again helping clients of mine follow an elimination diet, go see functional doctors, check if they have any hormonal imbalances to help them. So to me, traditional medicine, there's a place and there's a time for traditional medicine. If you break a bone, yes, please go to a doctor and go to the ER. But for other chronic illnesses, it just doesn't make sense, and I'm a very logical person. I need to understand what's happening. I can't just go and take medication and just, oh, okay, this is going to help me. No, I want to know why. Why is this happening? Why am I getting migraines? Why do you have a thyroid imbalance? Did you go through any trauma that helped, that caused such a shift in your body that affected your hormones? And this is true, that these things happen. And so when I realized that everything is related together, I started using that with my online consultations. And I started passionately helping women around the world and men, because I do have a lot of couples that sign up with me. So what I'm trying to say is natural health helps in all phases of life. As a mother, as a child, to help your husband, your mother, your in-laws. Everyone has a chronic illness, and everyone wants to understand what's happening to them. And unfortunately, the attention right now is just go to a doctor, get some medications, and solve the problem. But unfortunately, that does not solve the problem. Some people have been on cholesterol medications, their cholesterol didn't go down. Okay, what's the reason? Why is your cholesterol high? Is it genetic? Are you stressed? Are you going through menopause? Because menopausal women, their cholesterol tends to increase. Unexplained, like just because of the hormonal shifts that are happening. So there's always a root cause to anything that's going on physiologically, whether it's mind, body, or your mental health, okay? So that's in a nutshell the reason why I started, and the reason why I truly do believe in using natural medications and natural remedies in finding out what's wrong and how to help you live a fulfilled life, and to help you feel better and feel better, and actually to be in good spirits and live a good life and increase your health span, not your lifespan. So health span is how long you can live being active, rather than lifespan is just your biological age. So I'm very passionate about this, and I'm very, very happy to have CNN now extending its services to Kuwait, and hopefully soon it'll be registered and Mu'taraf of Kuwait as a degree that you can practice with. It's a first step to see this happening here, and I'm really, really happy to have them here in Kuwait. Thank you.
Thank you so much, Donna, for that lovely presentation. So we're now going to take around about 35 minutes break, 40 minutes break until our next talk. The next talk is a really important one. It's all about the CNN training concept. So it's really about who we are as a college, the courses we have on offer, and this one will be delivered by our principal, Herman Kepler. So feel free to hop out the door.